Hi everyone, I'm Pinky. I'm a clinical pharmacist practitioner. I work in a GP practice in United Kingdom. So today what I'm gonna discuss is about eczema. What are the symptoms, how to take the history, the management, when to refer the patient, and when to admit. So what is eczema? Eczema is when our skin loses its barrier, the barrier is damaged, and our skin is no longer protected. So what are the symptoms? How do we take the history of eczema? So basically, I'll ask the patient about the personal history. Do you suffer from any hay fever, any asthma? Then I'm going to ask about the family history, that any of the family members suffer from eczema. And how long have you been suffering from dry skin? Is it more than 12 months or less than that? If there is any itchiness and any other symptoms. Treatment of eczema. So how do we manage eczema in primary care? So the first line will be emollients or cream 2 to 3 times a day or when required. The main idea is to moisturize the skin all the time. Make sure the skin is moisturized. Moisturize, moisturize, and moisturize so that our skin is protected. If the moisturizing cream is not good enough, then I'm gonna prescribe some steroid cream. I'm gonna go from the mild to moderate to potent or very potent, depends on the circumstance. So to begin with, I'm gonna give the mild one, which is hydrocortisone. If it doesn't work, then I'm gonna go for the moderate, which is betamethasone 0.025%. If that doesn't help, I'm gonna go for the potent one, which is fluticasone, mometasone, betapitazone 0.1%. Otherwise, I'm gonna go for the very potent, which is clobetasol. The main idea is basically to use the pump to avoid contamination. For the emollients and moisturizing cream, a pump is better. And another main important thing is the cream needs to be applied in the direction of hair growth, not against the hair growth. If it is against the hair growth, there can be infection of the hair follicles, which is known as folliculitis. I also advise my patients to use the emollients and the creams as a soap substitute. It helps. It helps immensely basically. Now, another important thing is if there is itchiness of the skin, antihistamine can be used for a short period of time. And there is another cream, crotamidone 10%, which is an excellent cream for itchiness, and it gives itch relief quite fast. Now, if there is no response to treatment, what do I do? Then I have to think about infection. Is it fungal infection or is it bacterial infection? Then I'm going to go for a trial. If there is no response to the steroid cream, the emollients, the creams, then I will suggest an antifungal cream with the steroid cream, and it is going to be a combination of steroid and antifungal agents such as hydrocortisone and miconazole in a combination. And then I also have to think that if the combination of steroid and the fungal agent, if it doesn't help, then I'm going to think about bacterial infection. In case of bacterial infection, the skin might look pussy, green, yellowy, and I might have to refer the patient for that bacterial infection as well. So if none of the thing works, then I'm gonna refer the patient to a specialist. And when do I admit the patient? I will admit the patient when I will suspect there is eczema herpeticum. What's that? Eczema herpeticum is an emergency situation where there will be infection. Together with that, the patient will have fever, and it will be very, very painful. The patient will be distressed. The patient will be very tired, and there will be blisters basically, which is uniform in appearance. And in this kind of situation, I will refer the patient to the hospital. Now, thanks for watching. Please do subscribe my channel and like it so that I can promote more about medicine and healthcare. And if you have any questions, any queries, pop your questions in the comment section below.